So good afternoon. It is 2:05. We do have 5 bills today that we're hearing. I'm going to announce the bill order in a minute. My name is Jocelyn Peña-Melnick. Welcome to the Health and Government Operations Committee bill hearings. And to my left, I have Vice Chair Bonnie Collison, and to my right, I have 2 lawyers today. We're really very lucky today to have 2 lawyers, Lindsay Road and Lisa Simpson. So I want to go through just some of the rules to make our life a little easier. I kindly ask for your patience if we encounter any technical or streaming issues, and you know that never happens here. It just happened about an hour ago, so just be patient with us. It's not the fault of anyone. Please set your electronic devices to vibrate, and I just did myself. As a reminder, there's no food or drink allowed in the gallery because our staff have a lot of work and they don't have time to clean after us. You will see us with drinks, so that's because we sit here for hours, so we have to stay hydrated. And we clean after ourselves, so that helps. For each bill, we're going to hear from the bill sponsor and the sponsor panel, followed by all in-person witnesses, favorable with amendment, and unfavorable, and then all virtual witnesses. We do allow virtual testimony here just because we want to hear from everyone, right? And some people do not have transportation. And when there's a large number of witnesses, I will alternate between favorable and unfavorable just to give everyone a fair chance of being heard. The bill sponsor testimony in this committee is not limited, but please don't abuse that. While all witnesses have 2 minutes to provide testimony, a timer is displayed on the screen. You'll see it, and you have 2 minutes to give your testimony. And when the timer will sound when your time has expired. I'm not going to be rude. I'm going to let you finish your sentence, but please don't continue on to 10 more sentences. So please adhere to our usual committee rules for our committee members of 1 question and 1 answer, and to a particular person on the panel, not for everyone. Members of the public will be able to view this live stream on the Maryland General Assembly website and YouTube. There are some members that you won't see at their chair. That doesn't mean that they don't care. You know, I know one of them is at a funeral, and there are a couple of people that are sick. We're human beings, so just be patient, okay? Today, we will hear the bill hearings in the following order. I'm going to start with House Bill 116, Health Insurance Federal Conformity Definition of Health Benefit Plan. Can you please come out with your panel? And that is a departmental bill. I'm going to follow with a second departmental bill, House Bill 33. And then I'm going to go to another departmental bill, House Bill 19. Then I'll go with House Bill 3. Actually, no, it's going to be House Bill 116, House Bill 33, House Bill 3, House Bill 119, House Bill 19, and we're going to end with House Bill 265. And if you wonder, how does she come up with that order? It's because if you have 1 witness, I'm going to call you and you're going to be out of here fast. If you have 20 witnesses, you're going to be towards the end, right? Because it's not fair. So we try to be balanced as well. So, long time no see, Acting Commissioner Grant. Can you please give us your testimony on House Bill 116?
Yeah.
And that is titled Health Insurance Federal Conformity Definitions of Health Benefit Plan.
Yep, absolutely. So, Madam Chair, Vice Chair, committee members, Marie Grant, Acting Insurance Commissioner, here, favorable with amendments on House Bill 116. As you know, the MIA typically comes to you every year with a technical update bill to update our code to reflect all the latest and greatest that's happening on the federal level with regulations. We had a pretty small version of that this year, and really the substantive portions of the bill are intended to align Maryland law with newly updated notice requirements in federal regulation for hospital indemnity coverage, which is a limited benefit. So it's not major medical. It's a specific kind of benefit that pays out a certain dollar amount if you are hospitalized for whatever reason. We're asking for favorable with amendments because between the time time that we submitted this to you all for departmental consideration. And today, there was actually a lawsuit and a ruling that cast some doubt on the federal regulation that this bill was based on. And we do have really good notice protections in Maryland law right now, as the Consumer Protection Unit, the HGAU, has flagged for you all in a letter. So we're asking for some grace while we work with them to see if there are amendments to this bill that we can work out. And that's the end of my testimony, and happy to answer any questions.
Thank you. Are there any questions for Acting Commissioner Grant? Vice Chair Collison.
Thank you, Madam Chair. So what I'm understanding is we have to figure out how we can make this work with the very recent federal changes?
Yes, so I think the discussions that we want to have, Delegate Cullison, is first of all whether the bill is necessary at all, given that we already have some strong protections in Maryland law, or if there is a benefit to tying these particular notice provisions to the federal regulation, which, as I noted, the most recent version of which has been struck down by a lower court and will continue to make its way through the court system.
So do we have to? We don't have to wait for the court system to complete its work. We can, we could go ahead with the way it is for now if there's a stay in the change.
Right,
Okay.
we could. We just want some time. Again, given the uncertainty of the new federal requirements versus what is frankly a pretty good protection in Maryland law for notices going along with these benefits, I think we're just asking for a little time to see if we can sort that through.
Okay. All right. Thank you.
Yeah, thank you.
There is a letter of concern in the file. Did you get to see it?
Yeah, and that's from the Attorney General's office that I referenced just now.
Okay.
Yeah, so we're in communication with them.
Okay, wonderful. Are there any other questions for the acting commissioner? Hopefully soon permanent. All right. Seeing none, thank you so much. And this actually concludes the bill hearing on House Bill 116. Next, we're going to go on to House Bill 33, and that is a departmental bill. Will you come up, please? And that's the Department of Service and Civic Innovation Maryland Corps Program Service Year Option Pathway Revisions. This is jointly assigned for members from the Appropriations Committee, and I don't see them here, but they're coming soon. Delegate Ivey, McComas, and Schindler's. Okay, go ahead.
Good afternoon, Madam Chair, Vice Chair Cullison, honorable members of the committee, and I appreciate your time. I'm Paul Montero. I have the blessing of serving as the Secretary for the Department of Service and Civic Innovation. I'm joined here by our Deputy Secretary, Sarah Flamang, and our Legislative Liaison, Megan Music, and to my left, Aaron Dolan, the Director of the Service Year Option. House Bill 33 is the first departmental since our department was created in April of 2023, and it's based on some operational and technical changes we hope to make. Since we started with the first class in October of 2023 that served through August of last year, more than 200 members completed their service and earned a completion award of $6,000. The inaugural class gained invaluable workforce experience, with over 170 of them earning U.S. Department of Labor apprenticeship credentials, 2,500 and more certified competencies, and completing 42,000 hours of technical training. Class 2 kicked off on September 11th at the University of Maryland College Park with nearly 600 members. More than double the size of the inaugural cohort. And I'm proud to say the cohort represents every county and Baltimore City, truly an inclusive cohort. And they serve at nearly 200 host site partners or employers around the state. This bill makes a couple of technical changes related to access. First, expanding eligibility for the young adult service year option pathway. It's limited currently to those who have graduated high school in the last 3 years. Or earned a high school equivalent. We hope to expand the age of eligibility from 18 to 24 instead of 18 to 21, bringing us in line with other efforts to support Opportunity Youth. The Governor's Office on Children has also submitted testimony in support of this change. Secondly, updating salary requirements to reflect there are certain jurisdictions that pay higher than the state minimum wage, We want to be sure our members are not disadvantaged, and the floor is set at that jurisdiction's minimum wage. And aligning residency requirements. We have one program with 2 streams, the service year option for recent high school completers, the Maryland Core for people of any age. The Maryland Core prioritizes Maryland residency but does not require it. And we are making a proposal that it should require Maryland residency. So these 3 updates strengthen our workforce pipeline, increase access to service opportunities, and ensure long-term sustainability. I respectfully urge a favorable report on HB 33. Deputy Secretary.
Good afternoon, Madam Chair, Vice Chair Cullison, and honorable members of the Health and Government Operations Committee and Appropriations Committee. My name is Sarah Fleming. I'm the Deputy Secretary of the Maryland Department of Service and Civic Innovation, and I'm here also to support HB 33. The 2 operational changes that I wanted to highlight include critical funding adjustments that improve efficiency and financial flexibility. The first is consolidating the program funds. So HB 33 merges the 2 separate funding streams, the Maryland Service Year Option Pathway Fund and the Young Adult Service Year Option Pathway Fund into a single program fund. This consolidation allows us to allocate resources better without requiring additional general funds. It also reflects how we operate the overall program as one program with 2 pathways. As noted in the fiscal note, you'll see that if we have the ability to transfer funds between the pathways, general fund revenues and expenditures may decrease because we would instead use the combined pathway resources. This allows DSCI more flexibility in utilizing the allotted funds every fiscal year. Consolidation also reduces the administrative burden of allocating costs to each pathway when the pathways are operated simultaneously, streamlining our staff time and creating reporting and operational efficiencies. The second to highlight is removing the Maryland 529 plan option. So in statute, the department was required to provide the option for members to receive their $6,000 completion awards through a Maryland 529 account. However, after thorough consultation with Maryland 529, we learned the only account owners can deposit funds in their accounts, and any deposits must be made with after-tax dollars. This makes it operationally impossible for our department to make these deposits. While HB 33 removes this option, we do want the committee to know that even striking this from statute, the department is committed to continuing our partnership with Maryland 529 in assisting members to open accounts and understand higher education is still a supported next step after completion of the program. These changes maximize operational flexibility and ensure participants can access their benefits seamlessly. I urge your support for HB 33. Thank you.
Thank you. Next.
Good afternoon, Madam Chair, Vice Chair, and honorable members of the Health and Government Operations Committee. For the record, my name is Megan Music, and I am the Legislative Civic Innovation Specialist at the Maryland Department of Service and Civic Innovation. Today, we are coming to you with the proposed cost-neutral enhancements to the SERV Act, which was initially established the Maryland Department of Service and Civic Innovation and the Maryland Core Program with the 2 pathways, the Young Adult Service Year Option and in the Maryland Service Year Option pathway back in 2023. And so essentially this bill is making 5 key operational changes, as mentioned, and 3 minor technical changes to improve the efficiency, accessibility, and sustainability. These changes are going to be streamlining our funding, updating the wage requirements, and expanding eligibility and aligning the statutory language with our current operations, all without a fiscal impact. The 3 minor technical changes are removing the inactive Executive Fellows Program, renaming the Governor's Volunteer Council to the correct name of the Governor's Commission on Service and Volunteerism, and formally integrating the Governor's Office of Service and Volunteerism into the Department of Service and Civic Innovation. This is reflecting all current operations within the department. The Department of Service and Civic Innovation urges a favorable report on HB 33. Thank you so much for your time and consideration.
Thank you. Thank you for your work, Secretary, on, getting the program. Maryland, I believe, is the first, right?
First in the nation.
Getting the program together, organizing, recruiting, right? And we are the beneficiary, the HGO Committee, of one of those students. And as Riley Dove, and she's in the back working.
Hard at work. Good.
Hard at work, absolutely. Thank you. I am going to open it up for questions. I see Delegate Kaiser.
Thank you, Madam Chair.
You're welcome.
Just a quick question, Mr. Secretary. How many people were enrolled that first year of this program? And if there's a second year worth of data to share that as well?
Thank you for the question. The initial cohort was approximately 270 people that started. We're currently 550 in the second class.
Excellent. I see Delegate Taveras.
Thank you, Madam Chair, and hold on, I want to hear you better. Thank you. Really quickly,
There's
They're smiling.
just so, is there a way for us to figure out the zip codes that are associated? Like how many, like a thematic map of how many kids came from where?
There is, yes, Delegate, and we can get that data to you.
Thank you.
And as we enter into recruitment for Class 3, opening up the application next month, we will continue to ensure that we have members from every part of the state in faithfulness to the CERVAX mandate.
Thank you.
how many of the counties in the city do you have right now?
So all 23 and Baltimore City are reflected in the current cohort.
Fantastic. All right, Delegate Rosenberg.
Thank you, Madam Chair. Can you sort of summarize the kind of work that people are doing and how has that evolved, if it has yet? Because you've only been in
Absolutely.
operation
Thank you
for
for
2
the
years.
question. And for the pilot cohort, we had a significant number of members serving in the nonprofit space. I believe almost a dozen state agencies currently, as we try to build a pipeline into public service. We have a universe of for-profit employers having members in community-facing roles. So it's a very diverse array, and we want to keep expanding the range of employers as we grow. We were at about 100 employers in the first year. We're nearly 200 employers this year.
I would also add, we do a lot of work to align many of the roles with the registered apprenticeship pathways to ensure that our members can leave with maximum credentials possible to prepare them for the workforce needs of the future.
If someone were to lose their job with the federal government because of recent executive orders, are they eligible if they're of a certain age or what? Or are they not eligible because they're too experienced and therefore?
No, I'm proud to say that in the pilot cohort and in this cohort, we have individuals at different seasons of life. We had some retirees in the first cohort, and the Maryland Corps option is open to people of any age. And so while service year option is currently limited to 18 to 21, the Maryland Corps option pathway is still there. And we do that intentionally to build cohorts of intergenerational learning. There's sending a cadre of people to an employer where maybe most are recent high school completers, but a few are more seasoned or if not retired. We believe there's a strong learning, and it makes the assignment more sticky in the sense of folks commit together and hopefully stay together to have a shared experience, even if they're from different backgrounds or ages.
Delegate Gazzoni, followed by Delegate Woods.
Thank you, Madam Chair. Could you talk a little bit about the service year program? Because I know that for some of the participants, it's really truly a gap year between finishing high school and going to college. For others, maybe they're not sure what they're doing or they haven't figured out the path. So what are you finding with regard to folks going to college that were planning to go to college, maybe some that weren't, now are, or just general path changing based on the experience they've had?
Thank you very much for the question, because we are tracking our members closely as they transition to alums, because there is it's the right thing to do, and there's a third-party evaluation that rightly looks at where are these individuals a year after they leave us, 3 years, 5 years after they leave us. And it's interesting with the pilot cohort, even though a quarter of them came in saying, I'm going to college, I'm definitely planning on going to college, but finances or the desire for some time, 25% of the cohort in terms of finishing did go on to college, but it wasn't the same 25%. People changed their plans over the course of the term, which is partly the point too. As we expose them and have them pressure test their plans, we want them to find where they truly fit as opposed to what seemed to be the next natural thing that maybe wasn't for them.
Terrific, thank you, and I look forward to seeing. So,
And we recently signed a contract with the University of Maryland as our evaluator, the School of Public Policy.
thank you.
Thank you. Delegate Woods.
Thank you, Madam Chair. Thank you so much, Secretary Monteiro et al. Delegate Guzzoni just walked past me a minute ago and she snatched the information from my brain and asked the question, and that's really what I wanted to know. Were people moving in the direction of their initial interest? And so thank you so much. I think what you all are doing is phenomenal and a phenomenal role model for other states. Thank you so much.
Thank you
so much.
Any further questions for the secretary? Seeing none, did you see the letter from LifeBridge?
Yes.
Okay, and I
Madam
want to
Chair.
thank them because they took two of the students and put them into jobs, but they have some gentle suggestions for the program. And I know that part of that is starting a new program. You're going to have, growing pains, right? And you're going to make adjustments as well. But they're very complimentary of the program as well.
Definitely. Thank you for pointing that out. And we're proud of the host site employers that have come alongside us. We want to be responsive to what they pointed out because these are going to be our partners for the long term as we grow the pipeline, especially in healthcare, life sciences, making sure that employers see us as a reliable pipeline for talent.
Wonderful. Well, I do not see any other questions from the committee. We just want to congratulate you on the work you're doing. Consider us a partner. Let us know if there's anything that we can do to help the program succeed as it's doing, okay?
Thank you so much.
Thank you for your service, everyone.
Thank you for your time.
And and I want to thank everyone out there who has allowed this program, to work, and all the businesses that are opening their doors as well. Thank you so much. This concludes the bill hearing on House Bill 33. We now are going to move on to House Bill 3, Delegate Bagnall, State Board of Physical Therapy Examiners revisions. And if you have people with you, will you bring them up, please? And the next bill after her bill will be House Bill 19. Good afternoon.
Good afternoon, Madam Chair, Vice Chair, and members of the Health and Government Operations Committee. For the record, I'm Delegate Heather Bagnall, District 33C in Anne Arundel County, here on behalf of House Bill 3, State Board of Physical Therapy Examiners revisions. You have my written testimony, so I'll summarize. House Bill 3 is a simple modernization bill. The bill clarifies the definition of licensed physical therapist assistants to be licensed under the State Board of Physical Therapists Examiners. It expands the membership of the board by one member, requiring that member be a physical therapist assistant, and changes the default of communication from the board from postal mail to email. By increasing the number of licensed physical therapist assistants on the board from 1 to 2, this bill ensures the board has capacity to meet their administrative needs, and by requiring the new member is a physical therapist assistant, strengthens equity throughout the decision-making process. Likewise, requiring that license renewal notices be sent electronically unless otherwise requested improves efficiency, reduces costs, and aligns the board practices with modern communication standards. This will allow the board to meet the needs of licensees, ensuring faster, more efficient, and more economical communication. The bill has no opposition, and you will see from the fiscal note no fiscal impact, as the cost of additional member will be offset by the cost savings of e-communications. House Bill 3 represents an updated approach to regulations in healthcare professionals, fostering both efficiency and inclusivity for practitioners and patients. For all these reasons, I respectfully ask for a favorable report on House Bill 3, and I will turn this over to the Board of Physical Therapy Examiners and Lori Kendall Ellis.
How are you?
I'm great, thank you. How is everybody?
Good.
Thank you, Chair Penna-Melnick, Vice Chair Collison, and the Health and Government Operations Committee members. I have very little to add to the wonderful information you've just received. I will briefly just add a little data, because I love data. So in order to reflect the accuracy of our workforce here in Maryland, we are asking to add the physical therapist assistant. That would raise our workforce ratio balance to 3 to 1. We have 75% of physical therapists in the state and 25% physical therapist assistants. Right now, the ratio is 5 to 1. So the equitable improvement would be wonderful. And again, minimal financial impact. And as far as the technology goes, we are very proud to say that when we send out emails to our licensees, we have a 99% open rate. Very, very few people ever change their email, but as we know, people do move around and addresses sometimes are not kept up to date. So for that reason, we would also like to utilize the technology.
And put the, and for those of you that are still waiting, if you could do what I did, put the microphone closer to you.
Oh, sorry.
Thank you.
You don't want me to start from the beginning, though. Great. So in ending, we are a self-funded board. We're dedicated to enhancing our efficiency and governance, our service to licensees, and fulfilling our mission to protect the public. And thank you very much for your support and others for supporting this bill today.
So much, and thank you for your patience. I'm going to open it up for questions now. Are there any questions of the delegate and her panel? Seeing none, you did such a great job that there are no questions.
Thank you very much.
So you may have an amazing, blessed day. And this actually concludes the bill hearing on House Bill 3. We're going to move now to House Bill 19, and then after that one, we go to House Bill 265, which will be the last bill of the day. For House Bill 19, will you please bring your panel? And this is a departmental bill. And it is titled Health Occupations, Nursing, Loan Repayment, Education, and Sunset Extension, Building Opportunities for Nurses Act of 2025. Good afternoon, everyone. How are you?
Good afternoon.
Good. Who would like to get started?
I'm going to get us started.
Go ahead.
Thank you, Chair, Vice Chair, and members of the committee. For the record, I'm Nilesh Kalyanaraman, the Deputy Secretary for Public Health at the Maryland Department of Health. We're going to tag team this. I'll start and then pass it over to my colleagues. There we go. Oh, come now. So thank you for having us here.
Senator Joe Besson likes to say that.
We're here in support of House Bill 19, which is a Health Occupations Nursing, a Loan Repayment, Education, and Sunset Extension bill. I'll cover the first piece of this, and that's to look at expanding the eligibility for the MLARP. That's the loan repayment program for nurses and nursing support staff. One of the pieces of this bill is to expand the definition of eligible field of employment to include for-profit employers. What we see is that in particular underserved areas, such as corrections, while the site may be a not-for-profit or governmental, the employer through contracted services is a for-profit. And so we want to expand our ability to be able to provide this loan repayment program for those practitioners in underserved areas. The other piece is also to allow needed specialists, such as nurse anesthetists in certain settings. Of course, this is for a critical need and if funding is available. Another piece that we had originally included was around eliminating the nursing support staff from this bill. And that was really a logistical piece based on the fact that we have not gotten to date any applicants for nursing support staff. That said, we have heard from others in the community that they wish for this to be kept in the bill, and we have submitted an amendment to that effect. We're happy to keep it in. We hope to see nursing support staff take advantage of this program at some point. And then the last piece is to extend the sunset for the tax credit program. It's set to sunset at the end of this fiscal year, and we'd like to extend that to June 30th, 2030, and that'll allow us not just to to continue that program, but also to conduct our analysis of the impact of that program. And with that, I'm going to turn it over to Rhonda Scott, the Executive Director of the Board of Nursing.
Thank you. Good afternoon, Madam Chair, Vice Chair, and members of the committee. For the record, my name is Rhonda Scott, and I'm the Executive Director for the Maryland Board of Nursing. And I'm here to testify in support of House Bill 19. In addition to the board's sunset extension, this legislation proposes to extend the Secretary of Health's authority over the Board of Nursing's infrastructure and HR operations for an additional 5 years. This partnership between the board and the Maryland Department of Health has resulted in significant progress in improving the board's operational efficiency, which includes upgrades to its IT infrastructure, increased staffing resources, shorter license and certification processing times, and an overall increase in constituent satisfaction. The board is extremely proud of and encouraged by these achievements. However, it recognizes that there is still work to be done. The board believes that continued operational support from the department will help to bolster its success with initiatives such as the major IT development project, to implement a new licensure system, which will resolve several findings identified by evaluations conducted in 2023 by an independent contractor and the Office of Program Evaluation and Government Accountability. House Bill 19 also adds an alternative pathway for nurses seeking licensure by endorsement into Maryland who would normally not meet the minimum educational qualifications. The bill permits such individuals to meet the minimum educational qualifications for licensure by presenting proof of certain additional educational credentials. The board is working diligently to ensure that we increase the number of qualified nurses in the state without sacrificing its obligation to protect the public. Thank you for your time and attention, and we respectfully request a favorable report.
Thank you, Madam Chair, Madam Vice Chair, and members of the committee. For the record, my name is Erin McMullen. I'm here today in my capacity as Chief of Staff at the Maryland Department of Health, but I would be remiss if I didn't share that I'm a proud constituent of the Board of Nursing as a registered nurse. Last week, you heard a lot about the progress that has been made since 2023, and I'm here today to ask for your strong support for House Bill 19 with the proposed amendments outlined by Dr. Kalyana Raman. The sunset you authorized in 2023 is coming to an end, and we're here with that good news. We've worked really closely with the board and developed a very strong partnership. We've made noticeable strides in a number of areas that we shared with you all at last week's early session briefing. As Executive Director Scott said, there still is work ahead for the department and the board, but we do urge strong support of House Bill 19 with the suggested amendments. This continued partnership is necessary to resolve all the outstanding findings that Director Scott mentioned and really get us to a place where we have that new system that hopefully can be leveraged for other health occupation boards. That concludes my testimony, and urge a favorable report on this bill. Thank you.
Okay, I'm going to open it up for questions now from the committee. I see Delegate Johnson, followed by Delegate Hill.
Thank you, Madam Chair, and thank you for coming to give us some information today. I wonder if you could expand a little bit on the testing sites and testing processes you have for some folks that are close to their 120 days expiration where they would have to repeat a program over. So I was looking on your website, and it says that you were looking to hire another vendor and try to get some sites approved and try to do some things. Can you let us know where you're at with that? Because the last thing we need is to have these folks expire, go over the 120 days and have to repeat a program. Especially that doesn't send a message to folks that have apprenticeship programs in the state of Maryland for them to have to do that. So can you explain that to us a little bit?
Sure, absolutely. Thank you for that question. So in addition to the board taking the deliberate action to approve an additional vendor, we've been working closely with the current vendor on its action plan to hire more test evaluators, which is one of the things we identified that causes cancellation of events. We're also working with that vendor to secure a site to conduct a mass testing event to address the backlog of candidates who are still waiting to test. The board has also reached out to the federal government just to review to determine if there were any options for waiver for these individuals. And unfortunately, we were told that no waiver exists for that. So neither the board or the state or any other agency can petition for a waiver. So our focus is to get the current vendor where they need to be with getting these test cancellations decreased. And then also moving forward with the procurement process. So we're still in the phase of procuring the new vendor.
Follow up, Madam Chair.
Yes.
So how many of these folks are waiting to be tested? And as a state, what do you need us to do to make sure this doesn't happen, that they don't run over their 120 days?
Well, right now, as far as the number of tests, those waiting to test, we don't have that number, but we can certainly provide that to you in writing. In fact, that was something that we requested from the new vendor, the current vendor, as we look to know how many individuals we're going to need to focus on getting tested.
Okay, and as a state, do you need us to do anything to apply for the waiver or whatever we need to do to make sure that these folks don't run over their 120 days before they get tested?
Sure. So when we reached out to CMS, we did ask about the existence of a waiver, but there is none. And so had there been one, we would definitely reach out and ask that the state apply, but we haven't, we've been told that there is no waiver at this point, at this time.
All right, thank you, Madam Chair.
Okay. And let me just follow up on that. Do you think that that's something that it will be worth actually pursuing?
Absolutely. We would appreciate anything that the state can do to assist because, it's important that we get these candidates tested and get them in the workforce so that, we don't have to, we can help with the shortage.
Ms. McMillan, any thoughts on that?
In my head, I'm thinking through all the different flexibilities that exist federally when there's like public health emergencies and things like that. We can go back and put our heads together and think about.
If you would do that, that would be great.
Sure.
And can you work with Delegate Johnson, please?
Yep,
Thank
absolutely.
you. Delegate Johnson.
Thank you, Madam Chair. I had one more follow-up. The vendor we have, are they operating within their contractual agreement now?
They are to the extent that they have the action plan in place and they're working to hire new evaluators, but they are still not meeting the testing requirements that we need them to meet, which is why we are looking at the additional vendor.
So that is something we can look at as a state?
Yes.
All right. Thank you, Madam Chair.
You're welcome. Delegate Hill, followed by Vice Chair Collison.
Thank you, Madam Chair, and thank you all for all the work you've put in and for this bill. I just need some clarification. I think the amendment that you were speaking to is the one that changes the residency hours or the community service hours from 100 to 90. That was mentioned in one of the letters of support with amendment. Is that the amendment that you were addressing, or is there's been reference to amendments, sure, and I haven't heard which amendments you're good with, which ones you're not, and I just want some clarity what we're talking about. And I guess,
sure. The amendments I was speaking to were the ones that are in the department's testimony. Dr. Kalyana Raman spoke to them earlier as it relates to the loan assistance repayment programs, okay, and allowing nursing support professionals to be able to participate in the program.
Okay, so the amendment requests to strike 100 and replace with 90 the number of hours required that one of the letters suggests is not one you are considering, and it's to align it with HB 496. I just want to make sure because I would have a lot of questions about why we don't align that other bill to go up to this 100 standard.
So we're aware of the other bill, and are considering a response to that, but I didn't.
Okay.
I think we're trying to draw those lines as well, Delegate.
Okay, and if I may follow up?
This is it, then we're going to go to Delegate Collison.
And I guess, can you speak at all to reports that I've had from people who are advanced practice nurses and have gone through that training recently, that there is a fair amount of inconsistency in how the acceptable training is coming through, whether it's mostly online or not, that there's not, some have residency requires, some don't, different states. Is some of this that you're doing trying to bring all that in with the testing, bring that on to some basic standard so we know that however entry, through whatever door to advanced practice nursing these people come in, that they're meeting a basic standard? Is that what part of what we're trying to do here?
Yeah. Is that for the loan assistance question, or I'm sorry.
Well, this whole bill's about the loan assistance, but you also are doing a testing and this other piece, and is there a nexus between that, or that's a whole separate issue?
Oh, I'm sorry. Yes, so that is a whole separate issue. So the testing is for our direct care workers, our candidates for certified nursing assistant. And in accordance with the federal guidelines, they have 120 days to take and pass the competency exam until before that they can work in the skilled nursing facility for that up to that 120 days, after which they will have to cease working.
Okay. All right. Thank you.
Yes, you're welcome.
Vice Chair Collison, followed by Delegate Taveras.
Thank you, Madam Chair, and thank you again for the work that you all have done to get us to a better place. So I'm going to put two questions that are related together. One is, I've read through some of the other written testimony, and there are a number of different amendments that are being offered. So I guess the question number one is, are you folks willing to sit down and talk about some of these amendments in this bill, or whether or not they could be addressed another way? And the second was, as we said earlier when you all presented, the collaboration, and everyone in their letters are saying how wonderful the collaboration is between the board and the Department of Health. But I would assume that ultimately the board wants to be independent, and it's going to be longer than 5 years, but I'm assuming that that's what you're working for. So then the question is, would you be willing, in terms of an amendment, to think about a way to build an actual transition plan with some metrics and expectations for outcomes to transfer over to an independent status? So that's it. That's all I have.
So I'm sure that the board would be open to discussing that. In fact, I think that the relationship and the continued support of the department is helping the board to actually lay the groundwork for transitioning to independence. So I'm pretty sure that the board would be more than happy to have those discussions, as well as look at potential amendments.
Thank you.
Delegate Taveras.
Thank you, Madam Chair, but I think Delegate Collison covered it. I think that Ricardo Jones from 1199 had some amendments proffered, and yeah, that one and the one from Ms. DeCita and some other ones that are included. I just think we just have to have a conversation to iron those out.
Thank you. I don't see any other questions. I do want to just quickly bring up I know that you have the amendment that you discussed. There's also the Maryland Hospital Association. Did you see that amendment?
Yes.
Okay. So I need to think about that and meet with them. The ones that were just mentioned by labor, the Maryland Association of Nurse Anesthetics, the favorable with amendment, you saw that as well?
I did not see that one. I need to
And they
find that.
request one amendment to modify the number of hours required to the nurse pre-sector tax credit from 100 to 90 hours.
Okay, that was the one that you were referring to, yes.
And then the other thing that I would like to address with you is that I know that when we initially passed this bill, we put in, the Department of Health was very generous to put in $10 million, to get this work done. We noticed that there's no money for 2026, and it says the fiscal note that it will be like in addition, actually because the Department of Health is going to extend its oversight, right? And they said it will cost $5 million or so. Could you address where that money, it says there are no funds included in the fiscal 2026 budget as introduced to account for MDH continuing infrastructure authority over the Maryland Board of Nursing. And that's because they're going to continue, right, for how many more years?
Potentially 5 if the bill passes.
Yes. So any discussion on that?
We'd be happy to follow up with you. We can circle back with our fiscal team about the FY26 budget. And I know last week we talked about the different fee increases that the board is working through right now. So we can also share that within the context of the regs that they're working on promulgating.
Look at page 7 of the fiscal note. And if you can address that with the committee, that would be wonderful, okay?
Absolutely.
Thank you so much. Any other questions for this panel? All right. There is someone, Camille Forbes-Scott, is she testifying?
Dr. Forbes-Scott is the Deputy Director for the Board, Madam Chair, and she
Yes.
was here just in case there were questions regarding
Okay.
the educational portion of the board.
Well, we appreciate it.
Yes.
Thank you so much. And welcome to HGO. It's great to see you, and thank you for the support. And look, thank you for everything you're doing. The board was, and I may say it, they're not saying it, it was a mess. It was a mess. Again, can I say it was a mess? Okay, so you're cleaning it. Is it going to cost to clean it? Yes. Is it worth it? Yes.
Absolutely.
Because we have a shortage.
Absolutely.
Okay, we have 43 acute hospitals in our state. And nurses do not just work in the hospital system, right? They don't stay within that 4 walls. So thank you for what you're doing, all right?
Thank you.
We're going to move on to Nicole Stevens, William Kress, Lorraine Aricott, Teresa DeSeta. Will you be so kind and come up? And will you get started as soon as you sit?
Sure.
Thank you.
So my name is Nicole Stevens. I am a registered nurse and have been for well over a decade. And I'm just going to go ahead and read. So for over a decade, I've been an advocate for my patients. Today, I'm here to advocate for myself. House Bill 19 directly affects me, as it would allow me to be licensed in the state of Maryland, where I currently live. Despite having an active Virginia and DC license and being able to work in Maryland with my current licensure, Maryland is unable to license me due to current policies. After my initial education for licensure, I have been able to return to school, completing my bachelor's, and I'm currently working on my master's degree to become a family nurse practitioner. In addition to continuing education, I've been able to maintain several certifications, mentor new nurses, and have been honored to receive the prestigious Daisy Award multiple times. Throughout my career, I have saved hundreds of lives and touched thousands more. I want to continue to be a valued member of the healthcare team by serving patients and contributing to the nursing community. If this bill passes, it will allow me to practice in the state that currently ranks in the bottom 10 states with just 8 nurses per 1,000 residents. When the nation needed nurses during a pandemic, and some actually left the bedside, I returned. Working as a full-time bedside nurse in the Baltimore area hospitals, caring for your constituents, while still maintaining my full-time remote nursing job. Now I'm asking for Maryland to step up and help me and my fellow nurses who are in the same position, and please be in favor of House Bill 19. Thank you.
Madam Chair, Madam Vice Chair, members of the HGO Committee. My name is Teresa DeSeta. I'm a registered nurse who resides in District 46 and a Doctor of Nursing practice student at the University of Maryland School of Nursing. In 2022, this benefit, the Maryland Preceptor Tax Credit portion, was expanded to include RN preceptors. However, since the expansion, only one RN preceptor, just one, has received this benefit. While HB 19 extends the sunset provision of this incentive, it does not provide a solution to resolve the underutilization. Over the past 18 months, I have investigated barriers, met countless stakeholders, and concluded that the eligibility criteria specific to the 100-hour rotation requirement does not reflect clinical rotation practices at Maryland nursing schools. COMAR regulations dictate 1 academic credit equals 45 clinical hours, making 90 hours and not 100 mathematically logical. Results of an environmental scan showed reducing the requirements to 90 hours would significantly increase potential eligible rotations. Preceptors are vital to workforce entry. Maryland's current nursing shortage will more than double over the next 10 years, which will further exacerbate the preceptor shortage, leading to decrease in nurses entering the workforce and will impact our access to care. A 90-hour amendment to HB 19 would increase utilization and align it directly with HB 496, sponsored by Delegate Robin Lewis. HB 19, with a 90-hour rotation amendment, is supported by the following 8 organizations: the Maryland Hospital Association, Maryland Nurses Association, Maryland Association of Nurse Anesthetists, Nurse Practitioner Association of Maryland, Maryland Chesapeake National Association of Pediatric Nurse Practitioners, Maryland Affiliate of American College of Nurse Midwives, Maryland Emergency Nurses Association, and Catholic Charities. For these reasons stated, I urge a favorable vote with amendment for HB 19. This is a great benefit for nurses. Please help us access it.
Thank you, Madam Chair, members of the committee. My name is Bill Kress. I'm here today on behalf of the Maryland Nurses Association and also on behalf of the Maryland Association of Nurse Anesthetists. We are in support with amendments of this bill, and quite frankly, I think Ms. DeSeta covered the issue with respect to the number of hours for rotations that a preceptor must meet in order to get the tax credit. It would make sense to us if you had it at 90 hours. Again, under current COMAR regulations, a student who does 45 hours of clinical rotations is entitled to 1 credit hour. So it's likely they're going to be doing 90 hours and not 100 hours. So this amendment is common sense. I think we can see that it's not working when only 1 RN has prevailed to get the tax credit for the rotations under the preceptor bill. Let me turn my attention briefly to the department maintaining control and cooperation and collaboration with the Board of Nursing. I would say my clients are very much in favor of continued collaboration. They do look forward to a transition plan and the board being independent again, but we think that additional resources are needed. There's still a lot of work to be done. We think the new software program and platform for licensure makes a lot of sense and is desperately needed. And we look forward to the General Assembly making sure that the department and the board have the adequate resources to get that done. That concludes my testimony. Thank you, Madam Chair.
Testimony today. And Ms. Stevens, I want to thank you. You emailed my office over the last month or so quite a few times, and I want to thank you for being an advocate and know that we read the emails and that we appreciate you, okay?
Thank you.
You're welcome. Are there any questions for this panel? Seeing none, thank you so much for being with us.
Thank you. Thank you.
Our pleasure. May we please have Lorraine Aricott, Teresa DeSeta, Jane Crinkett, and Joshua Harrell. Those are the last witnesses. Any of you here? Please come up.
I already spoke.
Okay. All right. Lorraine, Jane, and Joshua, are you here? Will you please get started? And good afternoon. Don't be shy.
Good afternoon, Chair Pena, Melnick, Vice Chair Carlson, and members of the HGO Committee. My name is Joshua Harold, Associate Director of 1199 SEIU Training and Employment Funds, a joint labor and management organization providing educational and training assistance to members of 1199 SEIU United Healthcare Workers East, the largest healthcare workers union in the nation with 10,000 members in Maryland and DC alone. I'm here to express my support for HB 19 with the following amendment: expand the statute to allow individuals employed at long-term care facilities be eligible for priority funding needs. Long-term care facilities face the same, if not additional barriers as hospitals filling their open positions. Expanding the eligibility to their workers would remove some of the financial burden they feel, and in some cases may enable them the opportunity to further their education, improving their skills, and ultimately the care they are able to provide to the ever-growing aging population residing at their facilities. Additionally, it's imperative that Maryland ensure there is funding to create and maintain separate initiatives that assist individuals with the cost of occupational certificate programs designed for nursing support staff. These programs are not typically ones where participants pay the cost through utilization of loans. In most cases, they must pay prior to beginning the training. At TEF, I've witnessed firsthand the rising cost of programs for individuals interested in healthcare careers. These are programs that create the skilled nursing support staff that are the backbone of the industry, roles that are experiencing major shortages across the country. Many funders across the state are hesitant to financially support these training programs for career seekers due to the low entry wages, making these recommendations that much more necessary. By investing in training program opportunities for nursing support staff, you're helping to prepare a new generation of healthcare professionals who will play a key role in enhancing the quality of care in Maryland. It's my hope that 1199 SEIU will be able to work in partnership with the committee and the Department of Health to ensure that the dire staffing crisis among nursing support staff in Maryland can be adequately addressed with the proposed amendments to HB 19 and suggestions from the work group. Thank you.
Thank you, and thank you for the work you do. Appreciate you. Next, please.
Hi, good afternoon, Chair Pena-Melnick, Vice Chair Collison, and members. Yep, I'm so sorry. Good afternoon, Chair Pena-Melnick and Vice Chair Collison and members of the committee. My name is Jane Krinke. I'm here on behalf of the Maryland Hospital Association and our member hospitals and health systems. We support House Bill 19 and believe we really appreciate the Board of Nursing's collaborative relationship over the past few years. We've seen a lot of positive changes and just appreciate this body moving that legislation to place the Secretary's authority over their infrastructure operations. We're seeing a lot of the fruit of that, and we're looking forward to the new licensing system. Back in 2022, we supported the creation of the Maryland Loan Assistance Repayment Program for nurses and nursing support staff. We participated in the stakeholder work group and believe that that's a good process that should continue. So we have one friendly amendment to create a standing advisory council. Just like they have for the physician loan repayment program, we think having one for the nurses makes sense and could be very valuable. So I included a draft amendment in our testimony. So happy to work together with the board and Maryland Department of Health. And we support everything else that's included in House Bill 19. We think it's a great bill, and we ask for a favorable report and consideration of our amendment. Thank you.
Are there any questions for this panel? Vice Chair Collison.
Thank you, Madam Chair. So, and Mr. Harold, I don't know the program really well, but the loan program, but what I heard you say is that nurses in long-term care facilities are not eligible. Is that the case?
For priority funding needs.
For priority funding, which is different from just the general grant program.
That's my understanding.
Okay, all right, thank you.
Any other questions? Seeing none, thank you for being with us today. We really appreciate it. As you know, in this committee, we do a lot of our work by subcommittee. So when we have the subcommittee, make sure to come. All right? Thank you so much. This actually concludes the bill hearing on House Bill 19. Now we're going to the last bill of the day, which is House Bill 265. Delegate Bagnall, will you please bring your panel? It is titled Dental Services Qualification for Maryland Dent Care Program and Study and Use of Dental Online Credentialing. With us today, we do have we want to welcome the Appropriations Committee. Thank you for joining us. Will you please introduce yourself? Let's start with you.
Delegate Einbach, District 1A, which is Garrett, all Garrett.
Wonderful.
Hi, Delegate Dana Jones, District 38, Annapolis and Anne Arundel County.
Hi, Delegate Alicia McCaskill, Baltimore County, District 44B.
And I want to say that you see some empty chairs. It doesn't mean that there's no interest. It's that some of our members are not feeling well. They're sick, but they're watching at home. One had to go to a funeral. So we're human beings, right? Things come up, but we are here and we're listening. Will you please get started, Delegate Bagnall?
Absolutely. Good afternoon, Madam Chair, Madam Vice Chair, and members of the Health and Government Operations Committee. Once again, for the record, I'm Delegate Heather Bagnall, District 33C, Anne Arundel County, and I'm honored to return with House Bill 265, Maryland Dent Care, which passed this committee unanimously and passed the House mostly unanimously last session. You have my written testimony, and as you've heard this bill before, I will try to quickly summarize. As our committee is well aware of our healthcare workforce issues, I don't think I need to belabor the stats on our oral health workforce shortages or on how essential oral health is to our overall well-being. But I will say that while we continue to face a workforce crisis, the cost of post-secondary education for dentists and dental hygienists continue to rise. House Bill 265 would expand eligibility for higher education loan assistance grants provided by the Office of Student Financial Assistance in collaboration with the Maryland Department of Health to part-time dentists and dental hygienists. You may recall from my testimony from the previous session, this bill expands the pool, not the pot. It expands the pool of eligible applicants, but does not expand or create any mandate on funding. These grants provide post-secondary loan repayment assistance for professionals who are employed or seeking degrees in those fields. Full-time dentists and dental hygienists are already covered under the original statute. However, those employed part-time are not currently eligible. By including those who are employed in dentistry part-time, HB 265 expands the pool of available dentists and dental hygienists in Maryland by easing the burden of student loan debt related to the profession. Now, there are some minor differences to the bill which passed last year from this committee. In response to the feedback we received from the Maryland State Dental Association, we have not included limited licensees in the bill. It also includes some study language which would attempt to assess and modernize the credentialing process for dental insurance carriers. Now, despite the alterations to the bill, it still retains the same convivial opposition as before, and though I do not disagree that the program is underfunded, I do believe we should not limit a tool to attract and retain quality providers when the need is so great by limiting the eligibility for loan repayment assistance. I will also point out not only was I the bill sponsor for House Bill 290, which is referenced in the opposition, but I was encouraged when I learned last session that our efforts to raise the awareness of the need for proper funding levels did not go unheeded, though I did learn it secondhand. The statute already requires that the applicant demonstrate financial need and that at least 30% of the patients treated by the dentist or in the practice in which the dental hygienist works each year for a 3-year period in a private practice or clinical setting will be Maryland Medicaid Assistance Program recipients. And the bill stipulates the office, in the collaboration with the Maryland Department of Health, may establish prorated loan repayment assistance for a part-time dentist or part-time dental hygienist participation in the program, not dissimilar to the MLARP program, which expanded to include part-time physicians and physician's assistants, which this committee moved in 2022. Additionally, this bill addresses an equity issue for part-time dental work. By expanding the loan repayment program to part-time dental hygienists, we are expanding opportunities to the women who make up 93.1% of the profession. And that is why we had support from the Women's Caucus last year, and I believe that there is a support letter pending as well. House Bill 265 is an important step towards remedying sizable shortages in dentists and dental hygienists in Maryland, while addressing issues in equity of access for women under the loan repayment program. This bill is budget neutral because this bill only addresses eligibility. For all these reasons, I respectfully ask for a favorable report on House Bill 265, and I'll turn this over to my panel.
Good afternoon. Chair, Madam Chair, and Madam Vice Chair, I thank you and the committee for the opportunity to testify in favor of House Bill 265. I'm Sally Alborn. I'm the CEO of Maryland Community Health System, a network of federally qualified health centers serving over 265,000 patients, all in health professional shortage areas of the state. Since the Medicaid adult dental program was implemented, thanks in large measure to you, FQHCs have provided dental care to thousands of people who did not previously have access to dental services. However, there are many Medicaid enrollees and others awaiting dental care. One of the significant challenges FQHCs face is recruiting dentists and dental hygienists. We simply are not able to compete with the compensation offered in the private sector. Therefore, we need to embrace every option available to us to meet the needs of our patients. Being able to offer loan repayment through the Dent Care program to part-time dentists and dental hygienists is one of those options. Being able to offer dentists and dental hygienists who may have child care and other family opportunities an opportunity to work in their profession and reduce their educational debt can make working in an FQHC attractive, even at a lower salary. I want to be very clear. Being able to offer, to attract and retain part-time dentists and dental hygienists with loan repayment as an incentive is of critical importance to our FQHCs. I urge you to make this opportunity available to dentists and dental hygienists and ask for a favorable report from this committee for House Bill 265. Thank you.
Madam Chair, Madam Vice Chair, members of the committee, my name is Dr. Sonia Bruton. I'm the CEO and president of CCI Health Services, a federally qualified health center serving Prince George's and Montgomery counties. I'm here to provide kind of the view from the ground. This would be a critical recruitment tool for us. Right now in the hygienist pool, we have 2 part-time hygienists filling what are 3 full-time positions. We were able to recruit those 2 part-timers because it provided the flexibility for childcare. This bill would kind of open the door more fully and allow us a more robust applicant pool. What we're getting from the market is hygienists coming in asking for salaries that are equivalent to our nurse practitioners and other physicians that we have on staff, and we're not able to meet those salary matches. This provides that added bit of support that allows part-timers to look in our direction to serve patients who are primarily Medicaid and uninsured. We are finding that it also allows that extra bump for somebody who wants to give back and didn't think they could afford it. It levels that playing field and allows them to look to us and to begin to join our workforce. The part-time option is becoming more critical in our settings because we often require what are called deep cleanings, that scaling and planing that requires much more aggressive use of your hands and your body. And so they're having to work part-time just to elongate their career. We're having more and more folks who are saying no to full-time work because they just can't hold up to the physical demands. So we ask for a favorable support to this bill.
Thank you. And thank you for the work you're doing. Which is, I would like you to share it on another time with the committee because I think it's amazing with the residency program as well. Next, please.
Good afternoon, Robin Elliott. I'm here on behalf of the Maryland Community Health System and Maryland Dental Action Committee, also in support of this bill. Just wanted to add 2 quick points. The first is that part-time eligibility is the standard in most loan repayment programs for clinicians. All of our loan repayment programs in Maryland for physicians, PAs, and nurses have part-time, and then 14 other states, as well as the National Health Service Corps, offer part-time, and I think all for the reasons that you'll be hearing today. I'll speak for just a minute to the provision of the bill that asks for the Maryland Insurance Administration to study whether or not dental insurers are using online credentialing platforms. With the Maryland Community Health System, we pulled together a group of credentialing managers to identify operational issues they've been encountering. And this came up over and over and over again. So even though online platforms exist for credentialing, which as you can imagine is a long form, a lot of paperwork, most insurers are still requiring providers to either fax or PDF and email their forms. This creates a whole host of paperwork barriers and delays. So what the bill does is just ask the Maryland Insurance Administration to study the issue to get a sense of where dental insurers are with online credentialing. And with that, I ask for a favorable report and happy to answer any questions.
I'm going to open it up for questions from this particular panel. I know we have one more person from your panel, and I believe that is is it Sarah? Is she here? Okay, will you come up and then we'll open it up and we'll finish that panel? Because we have an unfavorable panel, and I like to call them just to have some balance. Good afternoon, and if you could put the microphone really close to you.
Sure.
I was going to say the microphone.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Sarah Ches, and I am currently the lead hygienist and quality control for Choptank Community Health School-Based Dental Program. I grew up on the Eastern Shore, and I am a first-generation college graduate. I wore the title of dental hygienist alongside the title of single working mother from the time my daughter was 2 years of age until she was 12. She just turned 14 last spring. Life can be challenging enough in a two-parent household, but it felt even more challenging when I became a single mother. As I mentioned earlier, I'm a first-generation college graduate, but I was also fortunate enough to have parents that were able to help care for my daughter while I worked full-time. Working as a full-time dental hygienist not only gave me the ability to provide for my daughter, but it allowed me to start repaying the large amount of student debt I had incurred. Navigating the world of student loan debt was something my family was unfamiliar with, and I was unaware of state and federal programs that I could have applied for to reduce the amount of debt I had incurred. I can think of many milestones I missed with my daughter due to my need to work full-time to provide a roof over our heads and start paying back my student loans. Learning about this bill makes me wonder how many milestones I wouldn't have had to miss if I were able to apply as a part-time dental hygienist and awarded the funds from Maryland's loan repayment program. I've been a hygienist here now for 18 years, and I can proudly say that 8 of those years have been working with Choptank Community Health, allowing me to make a difference in the community I grew up in. I love our mission at Choptank, the community in which we serve, and the services we can provide our patients as an FQHC on the Eastern Shore of Maryland. My passion for our school-based dental program has only grown stronger since starting 8 years ago, and it is for this reason that I can see myself working for Choptank until I retire. Everyone has a story, but I wanted to give some insight into the difference passing this bill could make for a first-generation college graduate or for a single mother. This bill would not only make a difference for a hygienist financially, but it also recognizes them for their educational and clinical skills. Why not allow part-time hygienists to apply for Maryland's loan repayment programs and give them a few extra reasons to come and apply in underserved communities and notice the difference they can make?
Yeah. You want to go ahead and finish, or you're done with your testimony? You're finished?
Yes.
Great. I'm going to open it up for questions, and because we were raised well, we're going to go to appropriations first and see if they have any questions. Do you have any questions? You can, none?
No, thank you.
Okay, none? All right. Now to our committee, I see Delegate Kaiser, followed by Delegate White-Holland, followed by Vice Chair, and then Martinez.
Thank you, Madam Chair. My question to the bill's sponsor, I heard part of this when I was in the back and then walking back in, and I heard you talking about that it passed last year, and I think you were talking about some changes, but I mean, it passed overwhelmingly. I had to check 136-3.
That's correct.
And it seemed like the challenges were in the state Senate. The changes that you have made, whether small or not, are they addressing things that you heard brought up on the Senate side? What were their concerns with this? Do you know?
The omission of the limited licensure is addressing a concern that came up on the Senate side.
Say it. I'm sorry. Can you say it again? I'm writing my
notes. Yes, the omission of the limited licensure candidates addressed a concern that was brought up in the Senate. The study language actually came out as Robin Elliott said, came out of conversations that happened during the interim.
Thank you.
Delegate White-Holland.
Thank you, Madam Chair, and thank you, Delegate and panel, for bringing this bill forward. I wanted to, and I'm sure, Delegate, you have called attention to the letter of information by the MIA, and so just wanted to know if you could expound upon that, as they are seeking some flexibility as it relates to the study's execution, and really examining Section 2 of that mandatory language. So I didn't know if you've had further conversations with them and what sort of offerings have been discussed thus far.
Thank you. And yes, we have continued to have those conversations. I don't think we're adverse to offering flexibility. And we also have a meeting coming up at the end of this week, because they recommended some additional platforms for us to consider.
Okay. Thank you, Madam Chair.
My pleasure. I have next Delegate, actually Vice Chair Collison, followed by Delegate Martinez.
Thank you, Madam Chair, and I apologize, I just couldn't resist. This is for Mrs. Harris. So I heard you say your passion for the delivery of services at Choptank, which I have visited, by the way, and you all are doing amazing work.
Thank you.
Can you speak to the increased numbers of students that you've been seeing in the program? And if you have an individual story that where I'm sure you have many, but if there's one that you could tell us that really made a difference for a student who took advantage of your services.
Sure, absolutely. So I have been doing this, like I said, for Choptank for almost 8 years now. And I can tell you when I started, that, for instance, Greensboro Elementary School is one of the schools. It's my first school that I go to. I think my student numbers started at 384. I just finished up that school right as Christmas break was starting for the kids, and I saw 510 students this year. The number of students has vastly grown, as you can tell from the numbers. But the need, if they don't see me, 9 times out of 10, they do not see a dental hygienist. They don't go to the dentist. I'm their first stop for them. I have parents that'll come into the wellness center when I work, and I feel like once I've started to look at them, that's when parents start to become more aware. I had a mom come in and she brought her son in. I had just cleaned his teeth, but she was worried because he had 2 adult teeth growing in and he still had 2 baby teeth left there. I feel like it starts to enhance and they start to see, hey, maybe I should ask a question about this, or they're more concerned about their oral health. Like I said, 9 times out of 10, they do not see a dental professional unless they're coming to see us in the school-based clinics. And that's where we come in to tie them back to clinic. If I see a child, we label our kids priority 1, 2s, and 3s. A priority 1 child is someone with an abscess. They needed to be seen a week ago. Priority 2 is a child that has several areas of decay, and we'll try to get them in as quickly as we can in the clinic too. But we have those priority levels, so I know if I call over to the clinic and work with our dental case manager, we're going to get those children in sooner rather than later. I can give you a quick story too. When I was working in Talbot County 2 years ago, I had a little boy, and he had just come here. His father couldn't read, couldn't write, didn't speak English, but the gentleman that the father was working for happened to be the emergency contact on his paperwork. We were able to reach out through him to talk to Dad, and his son had an abscess in every quadrant in his mouth. How he was eating, I don't know, but immediately my first go-to, he was signed up for our wellness program, so we had the school translator came in, and I was able to connect him virtually with our medical side of the dental clinic, and we were able to start an antibiotic for him to alleviate some pain and get him help. But it doesn't matter what county you're at on the Eastern Shore of Maryland. I mean, every county has those heartbreaking stories of kids that the father had no idea, and no loss to him. It was just he wasn't aware that his son's teeth, that he was in that much pain and had that much, the toothache was that bad because the son had become so used to it that it amazes me. I don't know if it was me, I would have been crying. I don't know how the child tolerated it, but if they use us as the connection to get further into the care is all I can say.
Right. Thank you very much for the answer.
Thank you.
Thank you, Madam Chair. And thank you all for your support on the bill. Thank you, Delegate, for bringing the bill again. I look forward to voting for it once more. My question is for Dr. Bruton. CCI just opened up a new health center. Can you inform the committee what legislative district and where that health center is?
We proudly sit in your district. We are thrilled for support that we have had and look forward to continuing all of the priorities that you have and serving the residents of the Greenbelt, Maryland area. And that location is actually pulling residents from all over the state for care.
No, I'm just, yeah, no, it is so. And I'm just really proud of the care that you guys provide. In particular, when I did the tour and I saw the section for the waiting area and just the culturally competent books, I've never seen Afro-Latino kids on books, like Black kids on books with Spanish. That meant a lot to me. So thank you.
Thank you.
That's awesome. Wow. Gazani.
Thank you, Madam Chair. I'm really happy to see FQHCs being able to share the value of this to them. So there's that. But mostly I just wanted to provide a point of clarification because Delegate Bagnell referenced this, the Women's Caucus has indeed endorsed this bill. And I should have a copy of the letter, you should have a copy of the letter, but we'll make sure it gets into the file.
We'll share it with the full committee. We'll make sure that we share it with the full committee.
I like it that you guys know how to share. Go ahead. Any other questions? Seeing none, thank you so much for the work you do in our state and for working with the primary sponsor. Thank you so much. We're going to now call a non-favorable panel, since this was a favorable panel, so that we can be balanced. I have Daniel Dorothy from the Maryland State Dental Association and Maryland Society for Oral Surgeons, and then we have the MSDA, Dr. Abeck. And welcome to the committee, and Happy New Year, first time we see you. Oh yeah, is Dr. Charles Doring here? Okay, great. Sorry, thank you. All right. You cannot accuse us of not being fair, so go ahead.
Thank you, Madam Chair, Madam Vice Chair, members of the committees. I'm Dan Doherty. I'm here representing the Maryland State Dental Association, respectfully in opposition to this bill. If I could point out one thing, the reference was made that last year's bill ran into problems in the Senate because of the inclusion of a limited license. Unfortunately, the bill, the way it's written, still would include limited licensees because 182404 subsection 1 requires them to be licensed to practice dentistry in Maryland. Limited licensees are licensed to practice dentistry in Maryland, so they are still included under the bill. Secondly, this law has what I would call three purposes. The first is to provide relief to students from their student loans, and they're astronomical for dental students, and they are not small for dental hygienists. And unfortunately, the funding is limited so that you only average about 6 dentists per year. And with the hygienists, it's a new program, and I think they're averaging 3 to 5 a year. The second purpose is to require them to practice in health provider underserved areas. And hopefully after 3 years of practicing in those areas, it is the hope that they will have established relationships in the community, have ties with their patients, and stay there. We do not believe that part-time practitioners are as likely to stay in these underserved areas as full-time practitioners. And I would note, and Dr. Doring will expand on this, but they're averaging about 6 dentists per year. So currently there's 17 dentists years 1, 2, and 3. With that, Madam Chair, we would ask for an unfavorable report.
Good afternoon. Charles Doring, a general dentist in Rockville, Maryland. And thank you, Madam Chair, Madam Vice Chair, members of the committees. You have written testimony, so I won't expand on that. I'll just add some additional data. I was on the Oral Health Care Task Legislative Forum Task Committee that brought improvements to the dent care program, and I thank Delegate Bagnell for that. We worked very hard on that. And I thank the state of Maryland for increasing the size of the tuition when someone graduates from dental school with $300,000 debt average. It's the most expensive professional school. So it is definitely attractive thing to get people to go to HIPSA areas. But as Dr. Delegate Bagnell said, there's only so much in the pot, and the pool is large. The program is administered by the Maryland Office of Oral Health. Currently, there are 17 dentists in the program. 12 are under the old fee schedule, and 12 are under the new. And when we added the dental hygienists, there are 5 dental hygienists doing their first year already in the program. The issue is the pool is large because those that applied that are eligible full-time are 34 dentists applied last year, and only 8 were awarded. So that's 25%, a little less were awarded of those applicants, and 10 hygienists, so 50% of the hygienists that applied, and these were all full-time. The only other thing I would add on the bill is being a Medicaid provider myself, and if you're going to look at online credentialing, I would please look at ePrep for Medicaid providers. I've been in Medicaid for a number of years. I just renewed, and it's been an absolute nightmare, and that my application has been rejected twice. And I finally got some help from the Department of Health, and hopefully the third time's a charm. So thank you, and I appreciate your time. Thank you.
Good afternoon, Madam Chair, Vice Chair, members of HGO. I'm Dr. Thomas Beckett, and I have taken over as the legislative chair for the Maryland State Dental Association from my colleague, Dr. Doring, who's now the president-elect. I also wear another hat. That's the hat as the president of the Maryland State Dental Association's Charitable and Educational Foundation. For those of you not familiar with us, we are the ones that put on missions of mercy in this state. We do a great deal of pro bono care in these health shortage areas. But I'm in opposition to this, and my colleagues have mentioned earlier that there's been so many that are full-time individuals that can't get the money. Expanding the pool is not really, to me, necessary unless we're going to increase the funding, which in this budget climate I know is impossible. The key issue is that the full-time practitioners become members of the community. They are there, they live there, hopefully. They meet people. They develop a rapport with the patients. They feel a connection to them. They're establishing a home, so to speak. And this makes it, hopefully they'll make that their permanent dental home so that they can treat those patients in the community, reducing the need for my foundation to provide pro bono care for acute dental needs. We want to keep the presence in the community. So I would like that to be the key ingredient for full-time. There's an old saying, if it ain't broke, you don't have to fix it. This program needs financial enhancement through funding and not dilution by opening up to the part-time employment status at this stage. If you want to increase the funding, I think it'd be a great idea. So thank you very much, but I'm in opposition and ask for an unfavorable report on House Bill 265.
Testimony. All of you for the work you've done in this committee in the past. We're going to open it up for questions now. Looking to my left, Delegate. Is for Dr. Doring. You cited in your written testimony here and also in your oral testimony a few moments ago that there's 3 purposes for this program. And one of those purposes, it was iterated by your colleague, that is developing connections within the community, right? Well, I have a copy of the code in front of me, and it very clearly states what the purpose of the program is. It's Maryland Education Code, Section 18-2402. The purpose of the program is to increase access to oral health services for underserved Maryland medical assistance program recipients by increasing the number of dentists and dental hygienists who treat that population. And that is it. That's the whole purpose of the program. And so I'm wondering if you can clarify the origins of those notions for the sake of the committee.
When you graduate from dental school, and it's 4 years professional school, your choices of where you practice are, hey, I'm going to go to where patients can afford the care, where I get the best contract. So to look at maybe going to Hagerstown or to the Eastern Shore may not look as attractive. So the idea is, hey, we're going to help defer some of this tuition debt that you have by setting up roots in the community, buy a house, start a family, be part of the community. So that is, may not be the way it's written in statute or law, but that I feel is the intent of the program. Thank you.
Followed by Delegate Riley.
Thank you.
Thank you, gentlemen, the Ds. Doherty, Doherty, and Doherty. I guess to one of the 2 docs, sorry, Dan.
Couple questions. You talked about there are only 17 dentists currently receiving the grants out of 34 applicants. The grants as written require that the dental grants be at least $50,000 per year. And I just thought that was odd that we're requiring a minimum. And if it were, I mean, you want it to cover, but it doesn't have to cover 100% to be of value. So if that were changed, so you could give out smaller grants and incentivize more dentists potentially, would that be an advantage? Would that improve the program and improve the participation, in your opinion?
Of the 17, some were in the old fee schedule program, so that's why the total is lower. And actually, giving out the 50,000 may give the total amount, would draw it back because there's only so much money in the pot. I'm not opposed to the part-time, but I just think, hey, let's give priority to those that are really going to set up in the community, whether it's a dentist or a dental hygienist.
May I follow up? All right. But that's the decision of those who are doing the grant. So they're looking at all the applicants. They're not required to include part-time. So if they see a number of full-time dentists and that takes the pot, there's no obligation to then extend some to the part-times. Is that correct?
Yes, I checked with the Office of Oral Health, and they consider full-time as 40 hours a week. So I think that they would give priority. If you did accept part-time applications, I think in theory, there would need to be a commitment of that part-time person to provide a certain number of hours, and they're already doing at least 30% Medicaid eligible patients to set up roots in that area.
Maybe offline you can help me to understand how much people who aren't in this program, if they're not going to the FAQs, what they're making generally and what they're being offered to work in these clinics, so we know what kind of differences we're talking about. Thank you.
Thank you, Madam Chair. Well, my question does actually go to Mr. Dan Daughtery. So your letter, I was reading yours, and it's kind of like the fourth paragraph down. You had mentioned that there could be a problem because this bill includes the internationally trained dentist, which, as I read that, are you saying that they currently do not even have a general license? And if that's the case for the full-time, what about the part-time? What are their, do they have good qualifications for us to be able to add them to this grant, and the hygienist as well?
Yeah, the way the bill is written, you just have to be licensed to practice dentistry. It doesn't have to be a general license. It can be a limited. So that would include individuals among the limited license Cs, internationally trained dentists. Now, most of them are going through an alternative path to receiving licensure. Okay. So it's sort of a on-the-job training in lieu of going back in the classroom for 2 years. So they, in effect, are, in my mind, and I'm a layman, but they're sort of akin to a second or third year dental student, and they would be getting prematurely the benefit of this program.
Gotcha. Thank you so much. Appreciate it. Thank you.
Delegate Bagnall. Thank you, Madam Chair. And I just want to give you the opportunity to respond, because I'm hearing a lot about setting up routes. And I'm just wondering if you have any data that would refute that somebody who was working part-time and, for instance, caring for an elderly family member or had children in the school system, that is also not setting up roots. The reason I ask this is because, once again, women make up 93.1% of the workforce, and women are often the caregivers for they are the caregivers for their families, and being able to work part-time gives them the flexibility to also give care. So I'm wondering if you have any data to demonstrate that is not also setting up roots.
Well, we don't, because we don't have any part-time that have been part of the program. I think the 93+% of the women workforce is in the dental hygienist profession, not the overall dentistry professions.
I believe that's correct. Can you speak to the percentage of women that are in the dental profession and not the dental hygienist
My
profession?
colleagues may be better. The last I heard is that the graduation rate from dental school was about 50-50, maybe a little heavier for women than for men.
Thank you. Thank you, Madam Chair.
Thank you. Any other questions? All right. Seeing none, thank you so much for your testimony.
Thank
We
you.
appreciate it. And I would, as I often do in this committee, encourage you to work with the sponsor bill as well. And I know you know her well. Okay. It's okay. We're going to call the next favorable panel, Caitlin McDonough, Dr. Morgan Rhodes, Terrence Lavelle, Aaron Dorian, Murray Backley. Good afternoon, everyone. How are you?
Good afternoon, Madam
Good.
Chair.
Hi, Caitlin. How are you?
Hey, good.
You
You're
can
good. I
get started.
kick us off. Caitlin McDonough here in favor of House Bill 265 on behalf of the Maryland Dental Hygienist Association. I will be relatively quick because I think the previous panel, including the hygienist that spoke on that panel, has already articulated most of our association's positions on this legislation. And I would just echo the sponsor. Sorry, Lisa. Sorry, Lisa. Sorry, I don't. I apologize. I'm sorry. I don't know how to turn it off. I apologize. I'm so flustered now. As a part-time mother. And we've worked with this committee for the last several years on a lot of scope changes and expansion, and I think with several members of the committee, and I think you'll recall from the the hygienists who spoke in favor of that bill, it really is often focused on getting out into public health settings on vulnerable populations, and it's something a lot of our students and younger members of our association are particularly passionate about, and we do see this bill as another supportive tool to allow them to do that. And I would just echo also what the sponsor said. Usually what's a barrier to many of my members providing full-time work is not that they're not there in the community, it's that they have other obligations, whether it be at home or in other positions. We do, it is a female-dominated industry, and I think you saw from our dental hygiene advocacy day last week where many of them met with you. They're younger, they're coming in, they do tend to be of childbearing age and things like that. So we are supportive of the bill as a tool among with many things to incentivize this type of service, and we urge a favorable report, and I apologize again.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Dr. Morgan Rhodes, and I'm a full-time dentist at Choptank Community Health System, a federally qualified health center on the eastern shore of Maryland. Being fourth generation from the shore, it was important to me to follow my passion in providing care to our underserved communities. Every day, we work to improve access to health care and provide exceptional treatment. I have found my job to be incredibly rewarding, but also difficult in balancing my career and personal life. I'm speaking today on behalf of my dental colleagues who feel the same sense of struggle in balancing between the two. Today, I'd like to highlight the importance of including part-time dental professionals in Maryland's loan repayment programs. To give an idea of the amount of debt incurred from dental school, the price for 4 years of school for me in particular would have been a crippling amount around $400,000. Unfortunately, not everyone can secure federal funding, so this leaves me wondering, how do people make this work and have a personal life? Unfortunately, fantastic, passionate candidates for our FQHCs are plagued with this question. This frequently leads to prospective dentists and hygienists going into private practice where compensation is higher for part-time, which allows them that work-life balance. When life gets busy, working full-time long-term is not sustainable for all providers. Allowing dental providers an option the option of being part-time and follow their passion in public health with receiving loan repayment would balance out the pay differential between the private and public health worlds. This would also allow us to gain and maintain providers long-term, which would in turn improve access to health care. To give perspective, Choptank Community Health served around 33,000 patients in 2024 and is growing every year. We've had openings for providers for months on end with little luck in filling them, as most applicants are seeking out part-time jobs with pay similar to private practice. The option of loan repayment tends to bridge that gap. We desperately need providers in any capacity to reach our needs. If we can employ part-time dental clinicians with the promise of state-funded loan repayments, we have a real opportunity to offset the shortage of dental professionals in our underserved populations. I urge you to consider passing this bill, and thank you all for your time.
Good afternoon, Madam Chair and Vice Chair. My name is Terry Lovell. I am the Chief Human Resources Officer at Chase Brexton Healthcare. It's a fancy title, really, to say that I do all the hiring and benefits administration, and I really, for my sake, is all of the folks that have given you guys testimony today, I really work for them. Very talented people that can work anywhere, very talented CEOs that you heard from. And again, the reason why they're here working in these FQHCs is because they're mission driven. They can work anywhere. So I would just sort of reiterate everything that you've heard today. Labor shortages with dentists, with dental hygienists. We in the FQHC world, we cannot compete with many of the other settings as well. And so offering sort of this flexibility to the service really gives us a leg up on recruiting and retaining staff. Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, distinguished members of the committee. Thank you for the opportunity to be here today to provide testimony in support of House Bill 265. My name is Mary Backley, and I am the Chief Executive Officer of the Maryland Dental Action Coalition. Many of you know, a statewide network of individuals and organizations working collectively to improve oral health equity and equitable access to care. I'd like to start my testimony by first thanking Delegate Bonnie Cullison for her leadership on legislation that established the Medicaid adult dental coverage, and Chair Pena-Melnick and this committee for its strong support of this legislation. Launched a little over 2 years ago, utilization rates for this new program are really quite extraordinary, with hundreds of thousands of adults, over 30% of the Medicaid adult population community, receiving much-needed dental care, many for the first time in years. As we all know, this will have a profound impact on their lives, on their overall health, on their well-being, and their quality of life. However, barriers exist for greater adult participation in this incredible program, particularly access to clinicians in safety net centers, which has resulted in adults unable to secure an appointment, or those who are fortunate enough to get an appointment, extensive waiting times to receive the initial care. Safety net center leaders have repeatedly shared their challenge in the employment marketplace and challenges with expanding the workforce to meet these community needs. Providing an opportunity for professionals to practice, to stay in the community where they are rooted and do reside, while addressing circumstances that really are beyond their control and leave them no choice but to practice part-time, is an important and necessary avenue for the large segment of the dental profession. This will also increase the safety net capacity to provide timely care for a larger number of residents within the community. I thank you for your time, for your support, and we respectfully ask for a favorable report.
Thank you. Thank you so much for being with us and for working with us on these issues. I'm going to open it up for questions for this panel. All right. Any questions from our committee? See, excuse me? Okay. Erin, she's coming next. Okay, it's okay. She's paying attention. Just kidding. Always. I do have a question for anyone on this panel, whoever is the best person. I should have asked the
sponsor this question, but there is a letter from the Maryland Insurance Administration, and it basically states that the agency respectfully proposes that the flexibility of the study's execution will be enhanced if Section 2's mandatory language were omitted, thereby granting the agency the ability to undertake the study through a legislative request and optimizing resource allocation for this initiative. Any thoughts from one person?
Well, and I think Delegate Bagnall somewhat addressed this with Delegate Hill's question on the previous panel, but I think from the Dental Hygiene Association, we're primarily interested in the expansion of the service, but as far as the study, I think we can certainly, work with the MIA on whatever flexibility they need to complete that study, but,
Okay.
we'll work that out.
Thank you. I don't see any other question. I want to thank you for being here and for waiting at the end of the day. Really appreciate you, okay? We're going to call the last witness of the day, Erin Dorian, who is not a stranger to this committee, or appropriations, if I may add. But she is working in a new role.
Yes, I am. Thank you, Madam Chair, Madam Vice Chair, members of the HGO Committee. For the record, Erin Dorian here as a board member of the Maryland Assembly on School-Based Health Centers in strong support of House Bill 265. MASBAC is an advocacy organization that promotes school-based health care and supports the 90 school-based health centers across the state, about 1/3 of which provide dental care. There is opportunities for more centers to expand to this service. However, they face the major barrier of finding providers. As school-based health centers often only need part-time dental providers, opening up the Maryland Dental Care Program to these professionals would support the recruitment and retention in these school-based health centers. For these reasons, MASBAC strongly requests a favorable report on House Bill 265.
Thank you. It's great to see you.
Good to see you too.
Are there any questions? Okay. Seeing none, thank you so much. Really appreciate you. This actually will conclude the bill hearing and our work for the day, but I will ask our members here to wait a second after we go down for one announcement. On House Bill 265, I want to thank staff and our lawyer for all the work you did today, even with the little inconvenience there at the beginning. You handled it very cool.